Hello, everybody, and welcome to The Better Life with Dr. Pinkston. I am Dr. Marianne Pinkston, and today I wanted to talk to you about a couple of items that have been requested by most of my patients in my clinic, also through a few emails, and for those of you out there who have reached out to me. And a lot of patients are asking me about inflammation. Inflammation is something that is very confusing because, we throw it at random and talk about it in a generalization in all things that as the cause of underlying disease. But inflammation is actually probably the most important underlying factor to all of our diseases. If you look at heart disease, if you look at stroke, if you look at kidney disease, if you look at neuropathy or things like multiple sclerosis and autoimmune disorders, inflammation is actually at the basis of all of these disorders. So at its heart, inflammation is in my mind the ultimate cause of all things that are life-ending for us, life-altering, decrease our quality of life, but also our quantity of life. You can also include inflammation at the basis of cancer. So these are things that I think are very, very important to target. Most of the time when I'm with my patients in clinic and trying to, talk to them, I've got 10 minutes to spend with each patient, 10 to 15 minutes. And it's really a shame because there are so many important things, especially in family practice, that I could focus on and talk with each patient, but I have such a limited amount of time. So I'm glad to have this opportunity to speak at length a little bit about something that is so important. Inflammation is something that occurs from head to toe. It's in every possible disease process that is out there. And if you look at inflammation, it's something that can start from an acute injury. So if you cut your finger, if you skin your knee, inflammation comes in, and it can be a good thing. It is there to try to heal all of the injuries that microscopic injuries to larger injuries that occur. Our body needs inflammation. It recruits a lot of blood cells. It recruits a lot of factors that can come in and heal and repair and restore the body. But it's when that process becomes chronic and long-standing that it becomes detrimental to our health. So we definitely want to focus on things that balance our body, help it to restore and repair and rebuild itself. And although inflammation can be a good thing, it's definitely something that we need to control. I tell patients who, marathon and ultramarathoners are avid exercisers that you actually are causing inflammation to your body. What happens is that inflammation breaks down certain pieces of our gut. It breaks down certain pieces of our muscle in order to stimulate a repair system so that we can rebuild and enlarge our muscle or repair and restore our gut. So again, inflammation can be a very good thing, but when it is a long-standing chronic process, then it does become a disease front and detrimental to us. One place that can occur that is detrimental for inflammation is in the arteries. So the arteries are all over our body. It leaves the heart and delivers blood to all the tissues of our bodies. It goes all the way to our toes and the ends of our fingers and into every organ, the kidneys, heart, brain. And that the artery system bringing blood flow and oxygen and nutrients is very important, that it has a nice, steady, easy flow. Over time, where we eat poorly, we sleep poorly, we don't exercise, we don't rebuild our system with restorative sleep, then inflammation starts to break down all of these areas. It starts to break down the arteries. It starts to break down the tissues. And that type of inflammation then will allow those blood cells and inflammatory cytokines and particles to cause damage to wherever it is going. One example is with cholesterol. So in cholesterol, our focus when we go to the doctor is always to get our lab panel and look at our cholesterol levels and see that our cholesterol is high. So our doctor generally will spend time with us and say, we need to lower your cholesterol, prevent heart attacks, prevent strokes, prevent other diseases, and we'll work with medication to try to lower your cholesterol. And I ask patients, or I try to present to patients that lowering our cholesterol can actually be a dangerous thing. if you think about it from a biochemistry aspect, cholesterol is a very necessary particle in our body. Cholesterol helps us to make our hormones. It helps us to rebuild our tissues. Heck, that's how we even make a baby. And so the tissues of our cells, each cell in our body has a cell wall. That cell wall is made up of cholesterol. It's made up of a lipid layer, and the cholesterol is at the basis of all lipid layers. So we need it. We don't want to get rid of it entirely. Yes, there are good types and bad types. So we try to focus on improving those numbers and improving our cholesterol and those types. But cholesterol in itself is not bad. Cholesterol becomes bad whenever we have underlying inflammation. So inflammation in the arteries will invite cholesterol, bad types of cholesterol, to come in and stick to the artery wall. And then the cholesterol will start to build and stick among itself with the continued inflammation. So when we look at cholesterol buildup, and you can imagine that the building in the artery, you would think that about 90% blockage, 90% blockage would be something that is dangerous to the inside of our arteries, when actually it is about the 30 to 60% blockage that is more dangerous. That little amount of buildup there, a small piece of cholesterol will break off and go further downstream to the smaller arteries and block those arteries, and that is where your heart attack or stroke will actually come from. So we try to, stop the cholesterol from sticking, stop the cholesterol from building on itself, and therefore what you would focus on is stopping the inflammation. So when your doctor starts a statin medication on you, they're actually not preventing your heart attack at all. They're putting off your heart attack. And in that trying to stop or prevent a heart attack, we actually need to go back to the underlying inflammation. The same thing happens for kidney disease. So if you look at kidney disease, the cause of inflammation there most often is uric acid. And I've spoken about this before on some of my shorts. And I also had Tiffany Smith on with the Texas Kidney Foundation. We talked a little bit about uric acid. Also, diabetes. Diabetes is an underlying inflammatory disorder that will invite renal disease. The other things that we look at with inflammation too is in the liver. And I think the liver is something that is very, very understudied, and definitely something that is not focused on enough when you go to visit with your doctor. I think inflammatory disorders, heart attacks, strokes, cancer, all these diabetes, all these inflammatory diseases, I believe, start in the liver. So the fatty liver, again, from dietary, bad diet, from lack of exercise, from diabetes and blood sugar, carbohydrate metabolism problems, that is all occurring in the liver over a long period of time, and will then affect and cause heart disease, strokes, cancer, and things like that down the road. So there are many, many organs involved. And all of this at the basis of all these diseases is just an inflammatory problem, inflammatory disorder. So when you try to look at things from an inflammatory focus, and when I talk to patients, I get, it's so difficult in that 10 to 15 minutes to tell patients that you are sick from head to toe. Yes, I'm checking your blood sugar. Yes, I'm checking your cholesterol level. Yes, I'm checking your thyroid and your hormones. But what you don't understand is everything that you are doing from the time that you wake up in the morning till the time that you go to bed at night. Your, activity or lack of activity, from everything that you wake up and take in your coffee, you put your cream and sugar in your coffee until you go to bed at night and you have your last little snack before you go to bed, everything that you ingest and put into your mouth during the day, all of these things are things that will feed the underlying inflammatory burden underneath. When I try to, get through this with patients and say that everything that you are doing matters. And yes, I know that food is wonderful. We live in San Antonio. We have a very rich diet. We eat a lot of things that we shouldn't eat on a regular basis. Most patients tell me, I would love to lose weight, but I love my food too much. I enjoy food. It's very social. It is, it's a joy factor in my life. And I tell patients that really that is ultimately the thing that you need to change. You can't out-exercise a bad diet. Exercise is good. Most patients will say, well, I eat okay, but really I don't exercise. I just need to add exercise. I'm like, that would be important and very good. But ultimately underneath, you need to change the way that you are eating. The food industry has not made this easy on us. In fact, they lobby to make it worse. They do this ultimately on purpose. This is how they make money and make their living and feed their families. Ultimately, the food industry has a very strong hold. And the myth and the weight loss industry, the health industry, is another billion-dollar industry. And what they focus on and guide us on is the next latest, greatest fad. That is how they make their money. So today it's a new plant, it's a new herb, it's a new diet. It's something new and fad driven to get everybody involved and mass purchase and become a mass production zone for us to get involved with and spend our underlying money to try to lean on our desperation to be healthy and to lose weight, when really we have all the information that we need. We've known for a very, very long time how to eat right, how to move right, all the right things to do in order to improve our health and lower that inflammatory burden underneath. We know what we need to do. We don't need the latest, greatest information, the latest, greatest fad of medications. The pharmaceutical industry is not inventing the next thing that is going to save our lives. It's not in research and development right now. We already know what we need to do. And in fact, it is so critical at this point that we focus on what we need to do and what we need to change, because our children, my children, your children, and their children are going to be the first generation to die younger and have a lower lifespan, life expectancy than us. And that is really, really sad that we are allowing the industry to slowly kill our next generation of children. So it's very, very important that we grasp a hold of this now. When I speak to patients about weight loss, about eating right, most people will say, well, I eat really well. I don't understand why I'm gaining weight or why my cholesterol is still bad. And I explain to patients, no, you really don't eat well. You are, patient. I'll ask a patient, what are you eating for your breakfast this morning, for instance? And they'll say, well, I had oatmeal, and it wasn't instant oatmeal. It was oatmeal, and I added a little bit of stevia to it, so an artificial sweetener that they feel is healthy. And I'll explain that is really a very carbohydrate driven. They'll add maybe a lot of fruit. So fruit and oatmeal you imagine to be very, very healthy. And I explain to patients that really health comes from a balanced meal. So a balanced meal of a higher protein and some fat. Fat is not as evil as we used to think it was back in the 90s when we went into our low-fat craze. So a balanced meal of protein, of fat, and a little bit of carbohydrate. So take that oatmeal and add protein powder to it, or add a protein source. You can add Greek yogurt. You can add, a meat of some sort, and balance your diet at each meal and each snack to be about 40% protein, 40% fat, 20% carb, and then you are eating healthy. When you eat something like oatmeal and a lot of fruit and you imagine you're doing something good and you have your glass of orange juice, sounds great, right? But actually it's very, very carbohydrate heavy, and carbohydrates are always one of the main sources of inflammation underneath it. A heavy carbohydrate meal drives a heavy carbohydrate diet, and that is where the underlying stimulation of insulin and other inflammatory issues in the pancreas and the liver then drive underlying heart disease and cancer and things like that. So you really have to look at these dietary measures and change things up. No, you are not eating good. And so I try to work with my patients, on a head-to-toe aspect and bring diet into that and show people, no, you really are not eating as well as you thought you were eating. And so, again, getting back to, the inflammation, there are cells in our body that will produce inflammatory cytokines. And you've probably heard this as a new little buzzword, inflammatory cytokines, or buzz phrase. And those are things that are little molecules that will come out of cells and attack the healthy cells of our body, the healthy tissues, and cause the underlying damage to the little arteries that infiltrate our kidneys, liver, and provide blood to the rest of the body, our healthy arteries. Cholesterol begins to stick and build up. That increases our risk of heart attacks and strokes. And then the breakdown of the neurological tissue, so in the brain. One thing that is of interest, I think patients should know, is that our brain actually regulates sugar and insulin, glucose and insulin on its own. It's separate away from our bodies. There's something called the blood-brain barrier that protects our brain and protects it from infections, from inflammation and other enemies that are outside of that are in the body and outside of the brain. So our brain has its own protection mechanism called the blood-brain barrier. Within that, our brain can actually separately control glucose levels and other inflammatory levels, hormone levels, insulin levels. And that is why patients will suffer from, dementia and diabetes, is from dysregulation of that carbohydrate metabolism. So in that, we call it diabetes type 3, maybe something you've never heard of, but this was actually, I think I first heard of it in the 2000s, so around between 2000 and 2006, this started to be a new buzzword of diabetes type 3. And that is brain diabetes, and that is where that dysregulation occurs inside of the blood-brain barrier, and you get the diabetic, high insulin levels and high sugar levels, high insulin levels. And so there's diabetes type 3. The other way that your body then becomes pre-diabetic or diabetic, again, this is one of the largest sources of inflammation and disease-causing issues, is the pre-diabetes. And when we look at weight loss and trying to control disease and inflammation, pre-diabetes, I think, is at the heart of all things that are causing us to be sick now. Every patient that comes to my clinic gets a full laboratory panel. And not just the usual, just a lipid test and a sugar test, but the liver, kidney checkup, maybe a blood cell count. That's what most doctors will check. But my patients get a full scope of tests, from insulin levels to their hormone levels, thyroid levels. I check many of the different vitamins. I check a deeper kidney panel, a deeper liver panel. So we really get a very good checkup when you come in. And the reference ranges that are listed on the laboratory panel are actually just reference ranges for the population average. It is not a reference range of what is normal or expected normals, especially for age. So when you look at your labs and you see those reference ranges, these are ranges for patients that are the same as a 9-year-old all the way up to an 80-year-old. And so it's really a population average. So when I look at those and I go over these results with patients, which I'll go over in the next half, then you are basing it on a sick population. So I look at glucose, which needs to be below 80, 85. I look at insulin, which needs to be below 10 to 12. I look at your triglycerides, which need to be below 100, not 150. And I'll look at your hemoglobin A1C. And the hemoglobin A1C is a 3-month average of your blood sugars. And that A1C needs to be at about 5.0 or below, not 5.6 and below. So I keep the numbers a lot tighter. And when I go over this with patients, I'm looking for prediabetes or insulin resistance, which is at the heart of all weight gain and at the heart of all inflammation and disease, heart attack, stroke risk, kidney failure, all liver failure, fatty liver, all the diseases that we are trying to fight these days and that are causing our shorter lifespan. I am going to take a short break. We'll come back on the other side. I'll explain a little bit more about hemoglobin A1C to you and how we fight prediabetes and a new way of fighting prediabetes. I do want to remind you, please, to go to drpbetterlife.com, please, and look at all my my previous shows. I've got a lot of great guests in the past. And I also want you to take a look at magnaweb.com for all of your B12 and your omega fatty acid and ALA and a lot of great disease-fighting, inflammation-fighting vitamins. Go to magnaweb.com, one of my great sponsors. We'll be back.
Depression, anxiety, low energy, weakness, these are just some symptoms of low B12 levels. And the absorbable B12 folate supplement that's helping people declare victory over depression symptoms is De Novo Plus B12 by Magna Pharmaceuticals. Patients with symptoms of depression often exhibit low levels of folate and vitamin B12. The human body needs sufficient folate intake to produce the essential neurotransmitters serotonin, dopamine, and norepinephrine. These neurotransmitters alleviate feelings of sadness, anxiety, and gloom. What makes De Novo Plus B12 so successful? De Novo Plus B12 contains readily absorbable folate and B12. That means it's more successful at correcting the root cause of your deficiency, not just the symptoms. Whether you are suffering with low energy, depression, fatigue, or anxiety, you owe it to yourself to learn more at magnaweb.com. That's magnaweb.com. Please let us know at checkout that you heard about De Novo Plus B12 on The Better Life with Dr. Pinkston.
Welcome back, everybody. We have been talking about inflammation today and heart disease and cancer and all of these factors that are shortening our lifespan and taking us away from our families and taking our families away from us and all of our everyday, plans for living long and strong. And so inflammatory disorders. When I ended the last half, I wanted to visit with you a little bit more about hemoglobin A1C. So many patients don't understand what hemoglobin A1C is. In San Antonio, we do because we are rampant with diabetes. But hemoglobin A1C is a 3-month average of your blood sugars. So if I look at your hemoglobin A1C and say it's 5.6, which is what is classically stated as a normal A1C, and it isn't, and I'll explain why. But that is looking back over the last 3 months and telling me that your sugars are averaging at least 100 or over. So I can change your A1C by giving you medication or telling you to change your diet. And over the next 3 months, as you change, we give you medication, change your diet, we can change your blood sugars and lower them and lower that hemoglobin A1C. So I mark this when I see my diabetes patients in clinic. I will use the A1C to guide me as to how well I am treating these patients, either with medication or with diet. Now, in our day and age, an A1C, the normal level has been moved from about 4.7, 4.9, 5.0. Now we've moved it over to about 5.6 as normal. Between 5.6 and 6.5 is labeled as insulin resistance or pre-diabetes, and at 6.5 and above is labeled diabetic. When I look at my patients and I go over A1C, I'm really trying not to be facetious, but my question to them is, with your A1C being abnormal, in my mind, an arbitrary cutoff at 6.5, in my mind, it's either you're pregnant or you're not. You either have an insulin disorder, insulin resistance disorder, or you don't. To try to pull your A1C backwards and get it as normal as possible, to me, is ultimately doing you the best favor in trying to battle all of the potential life-ending diseases that are out there. And the A1C, if I'm allowing you to be 6.1 or 6.3 or so and not treating you as though you are already diabetic, in my mind, is a huge disservice. If you have passed about 5.0, 5.2, you are insulin resistant. We need to treat this and be very aggressive with it because you can have the same outcomes as somebody who's full diabetic. You can have the, loss of vision. You can have, kidney disease, eye disease. You can have the, diabetic neuropathy changes to your hands and feet, the burning and stinging effect of the hands and feet. You can have heart disease, strokes. All of these diseases are just as possible in the pre-diabetes zone as it is in full-blown diabetic. So that needs to change, and that's something that the industry needs to look at. But I work with my patients. I also try to, help you understand that by pulling down your insulin, sugar, triglyceride, all these values, that not only can you live a healthier, better life, but you can also lose weight better. When we give these medications now, the popular weight loss shots, so the Ozempic, semaglutide, those are the same things, or the tirzepatide or Mounjaro that are so popular right now. By giving these medications, we actually are affecting more than just blood sugar. We are actually lowering inflammation and allowing the body to regulate its carbohydrate metabolism much more easily. And that in turn will overall reduce inflammation and reduce disease. Many people are very resistant to try to use medications in order to, normalize their A1C and their sugar and carbohydrate metabolism issues. But medications at this point are very necessary because most people don't really understand their diet. They don't really understand what they need to do to change their disease progress themselves. And anybody, from now over 50 years of age has insulin resistance. I was once 300 pounds. I've said that many times on the program, and had lost 180 pounds. I had full-blown diabetes at one point, and now my A1C lies about 5.4 on a regular basis, even though that I eat beautifully and exercise many times a week. I'm still insulin resistant. It's very, very difficult to fight. And most everybody has this issue, especially 50 years of age and older. So, the medication front now is a very important piece. And I know I'm not much of a medication prescribing physician. I try not to prescribe too many meds, but these days I think we really have very, very limited choices in good foods. We have a lot of genetic modifications. We have a lot of added sugars, and we have a lot of misinformation and myth in our world of food. And so we have to augment with certain medications in order to improve this. There are supplements that you can use to do this as well. There are things like berberine and curcumin. There are many types, alpha lipoic acid. All of these things help to lower our carbohydrate, metabolism issues and try to help improve and repair inflammatory disorders underneath. But at the same time, I think ultimately we just have to stare in the face of our food and what we were eating. So, inflammation is something that I really wanted to address with everybody today, and address it from kind of, an introduction. This is an issue that is too large for my short, program, the 27 minutes that I have. And so I wanted to use this as an introduction, and I hope in the next coming weeks to dive a little bit deeper into it. And so we will, but I definitely want to wish everybody great health out there. Please take a look at your diet and your exercise and what you're doing. Remember, you cannot out-exercise a bad diet. Dietary changes are the number one thing that you can do. The other thing that you can do is sleep well. And I'm going to include some information on my link tree. If you will go to drpbetterlife.com, you can get links to all my social media. You can also take a look at a lot of my previous shows. I've been doing this for 3 years now, and it has been a wonderful ride. And I've got plenty of information on the weight loss shots and inflammation and heart disease and many other factors. So go back and take a look. drpbetterlife.com. You can also get to my social media, and that way you can get to my link tree and find out more about some of the supplements and the diet and exercise ways that you can control inflammation. I wish you all great health. Have a great week. I'll see you next time.